Hi everyone, welcome back. So now we're going to start talking about the actual licenses and the possibilities that will define the best path for you to take towards your practice. And as an exercise and to make your life easier when I'm explaining all the licenses, we are going to do a template together where you are going to get now a piece of paper and a pen, and you're going to write down a few things about your training and your history so that you have these very clearly outlined and it's easier for you to understand when I'm talking about the different licenses, okay? So on this piece of paper here, the first thing that we're going to mark on is going to be immigration status, okay? So basically, I need to know if you are on a work permit, if you are on already have a permanent residency or not, or if you're a Canadian citizen, okay? So basically, you're gonna put your immigration status as number 1 up there. And that is because there are a lot of licenses that will require you to be a permanent resident or a Canadian citizen, okay? So it's important that we have that understanding right off the bat. Number 2, you're gonna take note of what English proficiency test you have. And if you didn't do one yet, you're then gonna get ready to do one. But basically, you're gonna write down what English proficiency test you have and what are your scores, so that when you go for applications, you already know what's your scores, okay? Number 3, we're gonna talk about exams. So basically, you're gonna write down which exams you've done and which exams you haven't done. Here, basically, you're going to write if you already sat or not the MCCQE 1. And if you have a pass standing in what score. Then we're going to talk about NAC, if you have done NAC or not. If you did the old MCCQE 2, which is doesn't exist anymore, but a lot of people have done it in the past and it might be useful. If you are someone who have done any of the USMLEs, which is the American Board exam, you will also take note over here, okay? So basically, you're gonna write down whether or not you have these exams, if you have a pass standing or not, okay? Number 4, we're gonna talk about postgraduate training, okay? So when we talk about postgraduate training, basically what I will need you to do is to write down how many years of training you have after medical school, or if you did a medical school that has internship included, you will consider the internship, okay? So basically we're gonna first look into internship. And now even if your internship was 18 months or 2 years, you don't count more than 1 year, okay? So maximum of 1 year, max, is what you're going to count for internship. Next is if you have any residency training, okay? So if you have any residency training, you're going to count here. And for residency training, we count all the years that you actually did. Next, we are going to take note of any further training that you have done. So further training can be many different things. So in some countries, it can be a senior residency. It can also be a fellowship. If you did a master's or a PhD that had research involved and it was an official program, you're also going to take note of that here. Okay? So we've done that. Okay, so now you have your postgraduate training, internship, how many years you did of internship, residency, and further training. Next step is gonna be your experience, okay? So number 5 is gonna be experience. Now for experience, you're gonna write down how many years you have, number of years, you have of independent practice, okay? So independent. So independent practice, we talked about it, is if you have a license to practice without supervision. So you're gonna take notes of how many years you have of independent practice. You're also gonna take note when was the last time you practiced with such independent license. If you are someone who has a clinical assistant license in Canada and you have been practicing, you can write that separately, because until recently, no provinces would consider that as independent practice or would even consider that to break the gap. Some new policies that came now, such as the Practice Ready Assessment in Ontario, will now allow clinical assistant licenses to break a gap, but it does not count towards the time required that you must have of independent practice, okay? So you might want to write that down there. Now, the next thing we're going to write down is how many years, or months actually, so how many months you practiced in the last 3 years. How many months, so you're going to write down basically how many months you've practiced in the last 3 years, how many months you've practiced in the last 4 years, and how many months you've practiced in the last 5 years, okay? So why is this? It's because it's going to be much easier afterwards for us to understand if you have the requirement in regards to the gap in practice, okay? So write down the number of months that you have practiced in the last 3, 4, and 5 years, okay? With this information in hand, now it's much easier for us to talk about licensing. So whenever I now start to talk about licensing, I will go over this framework and I'll ask you to get this information so that we can know whether or not you would be eligible for a license, okay? So this is basically a template that you should fill out, have it ready before you start watching the next videos so that you understand very well what is your situation when I start talking about the licenses that we will now start to navigate all the way from British Columbia, working our way to the East Coast on Newfoundland, okay? Okay, so if you have any questions, please make sure to leave them in the comments below. I will see you on the next video.